Welcome, everyone. Thank you so much for joining us today for the first ever TrovaTrip Town Hall. My name is Hope. I'm a trip designer here at TrovaTrip, and I've had the incredible opportunity to design and travel on our trips to Morocco, Bali, Peru, and more. So I, for one, am super excited to talk to you today about the future of travel. I know that with everything 2020 has brought, it's really difficult to comprehend what travel will look like in the future. And I know that there's a lot that we can't control. With that being said, we decided to have this event to shed some light upon the things that we can control. So today we're going to go over planning your return to travel, precautions that our operators are taking, responsible and accessible travel, the economic impact of tourism, how it's been affected by COVID. One of our hosts, Katie Duke, is going to share her experience with COVID, plus her travel tips. And we'll close out with a Q&A where you'll have the chance to learn even more from our guest speakers. So without further ado, let's go ahead and meet them. First up, we have Katie Duke. Katie, why don't you introduce yourself?
Well, hello, everyone. My name is Katie Duke. I am a board certified nurse practitioner based out of New York City. I am also a COVID survivor. And most importantly, I am a TrovaTrip travel host.
Awesome. Thank you, Katie. Next up, we have Discova. They are a certified tour operator who will work with us in Bali, Thailand, Vietnam, and Cambodia. First up, we have Carolyn.
Hope. Thank you. Hi, my name is Carolyn Manning. I am the Business Development Manager for Discover, and I'm based in Los Angeles. So my passion is responsible travel. I have a master's in sustainable tourism and regional planning. So I love travel because of all of the unlikely connections I get to have and the hands-on education it provides. So I work in partnership with Trova to create unique and local experiences all around Asia.
Thank you, Carolyn. And next we have Tu Anh.
Hello, everybody. My name is Tu Anh, and I'm also a trip designer for Discova. I'm from Vietnam, but I'm based in the beautiful island of Bali. The partnership between Discova and TrovaTrip started 2 years ago with Hope working in our Bali office, and the rest is now history between us. For me, travel is a part of self-exploration, and the more I travel, the more that I come to understand myself.
Thank you so much, everyone. Super excited to hear from you all in just a little bit. But first, I'm going to talk about safety. So safety while traveling is our highest priority. And this entails the safety of our travelers, our staff, our operators. We sent each of you a PDF prior to this event with some of the precautions that our operators are taking, plus some commonly asked traveler questions with answers. Some of these operator precautions include a self-screening questionnaire upon arrival, reduced capacity during transportation to support proper distancing. Face masks are required during all transfers, and anytime distancing isn't possible. Contactless check-ins and extra sanitation is available throughout the duration of the trip. As a company, TrovaTrip is also taking action to make sure all of our travelers and hosts feel safe and are supported throughout the entire process. So if you have any questions, please give us a ring, DM us on Instagram, or email us directly at hi@trovatrip.com. Our team is here for you. Just let us know your questions. I'm now going to pass the mic to Carolyn. She's going to talk us through some COVID precautions, some of the incredible initiatives that Discova has taken when thinking about the impacts of travel, as well as some of the trips that we've designed with them. So Carolyn.
Thank you so much, Hope. Yeah, at Discover, our #1 priority is always the health and safety of our guests. So our COVID-19 protocols we've set out are in line with the best practices across the industry. So everything that you're hearing today could change in line with local government requirements or regulations, because those are always our main point of reference. So our protocols are set to protect both the customers and our staff and are mainly aimed at prevention. So our protocols also cover actual and suspected cases, including a clear set notification procedure for TrovaTrip, as well as Trova's customers. So as a company in the destinations where we are operating, we are limiting the amount of people that we allow in all of our vehicles. We're providing masks and sanitizer. We're sanitizing all of our vehicles. We have contactless check-in at hotels, and we're prohibiting food and beverage sharing, which is actually really sad for us because we are such a foodie company. So we have an incident response team in all of our destinations in case someone were to get COVID. Responsible travel. So responsible travel takes into full account of the current and future economic, social, and environmental impacts we have while traveling. This addresses the needs of the visitors, the environment, and the host communities. So the most important thing that we can do when we're choosing to travel responsibly is to choose where we put our money. So we have a choice as tourists to use our dollars towards local communities in an effort to help maintain the beautiful culture, traditions, and the land of the places that we visit. So you can do this through visits to local villages, museums, independently owned restaurants and hotels, or even a national park. So Discover is making our best efforts to do this through a variety of ways, some of which are mentioned here. So we have our local guide ambassador program. So here we train people in marginalized communities to work in tourism and hospitality. We have a 3-month training program that's fully funded by us. So if you are traveling in Bali with us, you might see someone that's gone through this program there. We are fighting against single-use plastic. For anyone that has ever been to Southeast Asia, you know that it's really hard to avoid a plastic water bottle. We do have custom designed cooler bags that we use outside of COVID in all of our vehicles that people can refill from. And we do have a partnership with Refill My Bottle. Refill My Bottle is an app. If you don't have it, download it right now. This app will tell you where there's clean drinking water all around the world. Just by doing these two things, we saved over 265,000 single-use water bottles in 2019. And we do have a variety of community development projects. So we partner with NGOs and social enterprises, and we go into the communities and we ask how we can best serve them instead of deciding it for them. Impactful travel, well, visiting Bali helps create jobs, it maintains culture, and it boosts the economy. So when it's safe and legal to do so, the best thing that we can do to help with the global economic recovery from COVID-19 is to get out there and travel. So we also have an entire brand of local life tours. They are food tours, they're cooking tours, they're spending time outside of major tourism hubs. And all of our local life tours ensure that 25% of the revenue always goes directly back to the local communities. A few examples of these you can see here of what we're doing in Bali and we're doing with TrovaTrip. We do have a seaweed farming tour in Nusa Penida, which is a pristine island just southeast of Bali. So seaweed is used globally in a lot of food and it's a large source of income for the island, but it's a dying craft. So when we go and we take tours and we teach people how to seaweed farm, we're benefiting the farmers, the local communities, and us as travelers get to learn a new craft. So this right here, this is actual sustainable tourism. This is tourism that's based off of normal life activities so the community can sustain itself even if tourism pauses, like this year. We also have a Muntaganang trekking tour. So this is a hiking tour that goes through an arid caldera through a local village. We are partnered with a local NGO that creates roofs that collect rainwater for a year-long water supply. And this also gives resources for farming, for handicraft making, for guiding, and it keeps people working in the village while travelers get to enjoy a gorgeous hike and a local experience. We are 100% dedicated to accessibility and diversity in travel. With Trova, we run different types of trips, from fitness focused to foodie tours to plus size trips. And we adjust all of our trips to make sure that they're inclusive for all types of people. For me personally, I love that the influencer travel community empowers so many different types of people and it involves so much diversity. So we're able to achieve this with wheelchair accessible trips. We have plus size trips. We have vehicles with additional seating for comfort. And we also design trips for travelers to choose their own adventure level. In fact, Trova host Katie Duke will be hosting one of our wheelchair accessible trips next year. Thank you.
Thank you so much, Carolyn. It's been so fun designing all those trips with you guys. Next, Katie is going to share her experience working on the front lines, what it was like contracting COVID-19, and her tips for traveling safely during the COVID era. Katie is hosting 5 trips and counting with us next year and beyond, everywhere from Italy, the Galapagos, as well as Bali on one of those accessible trips that Carolyn just discussed. So Katie?
Yeah. And can I just take a minute to say that Italy trip is going to be nothing but eating and drinking, and it's going to be fabulous. Thank you guys. So my name is Katie Duke. I am a board certified nurse practitioner. I live and work here in New York City. I worked the peak of the COVID crisis back in April of this year, and I was working at a very hard hit hospital in Brooklyn that was serving a very underserved population. And, as I'm sure a lot of people here can remember, we really did not have a lot of information about COVID, approaches, treatment, and also supplies we were a little short on. So I was basically wearing the same N95 mask for up to 2 weeks at a time, and I contracted a severe case of COVID. And as you can see by these really sexy pictures here, this is me before I got COVID in the nice lab coat looking all cute and happy. And then the picture with the peace sign is me while I was actually admitted to the hospital. I got such a severe case that I was required to go to the hospital, and I was admitted for 2 weeks. Never been in the hospital really a day in my life. And I ended up contracting COVID pneumonia. I got remdesivir, steroids, the whole 9 yards. So I have a super personal experience on both sides of the stretcher of dealing with COVID. I have been a provider taking care of COVID patients in the ICU and on the medical units, and I have also been a COVID patient. So your information that you're getting here on this Trova Town Hall could not come from a more reliable source. So with that being said, I want to first start out by getting into a little bit of information just to kind of put you guys all at ease, because really when you think about returning to travel, we have to think about the right ways to approach that, okay? And something that I'm really excited about, that specifically, is one of the reasons why I like partnering with TrovaTrip is that group travel takes a lot of the stress and a lot of the, major accountability away from when you're traveling like as an individual, right? Whenever you travel with groups, you have a lot of people here who are going to give you information. You're going to have lots of resources. You're going to have lots of support. And traveling with a group means that there will be guidance and resources, and you're not in this alone. So you're going to have plenty of people there to help answer questions, plenty of people to help you get information. So first of all, just want to put that out there. So let's talk a little bit about how to return to travel. I know it's something that seems so far away. However, it's really not that far away, especially since, we've kind of already made it through 2020. So just a little bit more time, we can all hang in there. There is a ton of information out there. The first and foremost thing is you guys have to make sure that you get your information from reliable sources, AKA don't get your information from Facebook. If you're getting your information from social media, you need to make sure that you're getting it from reputable, educated, trained healthcare providers, public health officials, governmental agencies, or research-based publications. You also have to take some precautions as an individual before you travel. So let's run through a few of those things. You always want to check with your employer's travel policy before you go to book your trip. If you have an employee like an employee occupational health department or employee health service, it's good to give them a call before you're planning travel, because there are some employers out there who actually say, well, if you're going to be leaving the state, then you need to quarantine for 2 weeks before you come back, or you need to quarantine for 7 days, or you need to quarantine until we give you a COVID test before you can come back to work. So it's just good to be able to plan that ahead of time. The other thing is you want to make sure that you address whether or not you have any at-risk people in your close bubble or your close circle. So an at-risk person is somebody who has an immune compromised condition, somebody who maybe had an organ transplant, maybe somebody who takes immunosuppressant medications because of a medical condition, or this could be, maybe you live with your elderly grandparent and they've had a lot of medical history, or maybe they don't have a good pair of lungs. So you want to take into consideration, is this person going to be somebody who you would have to stay with after you travel? Because if you do live with this person, then it might be good to make different arrangements for where you can stay for a little bit of time when you return from traveling, at least until you have test clearance. Also, COVID testing within 24 to 72 hours of your departure time. Now, there's a caveat to this. Each country may have different travel requirements. There are some countries that say, we want you to have a COVID swab test within 72 hours. Other countries say, we want you to have this within 48 hours or 24 hours. The good thing is that TrovaTrip is going to be vetting all of these requirements before the trip goes on, and we will all be fully aware of what we need to have before we travel. So you always want to make sure that you bring two things. Your test needs to be printed out on paper. Like, yes, you remember that old weird stuff called paper that we have to actually like put in like a bag and carry with us? Yes, you need to print out your test result on paper, in addition to having like a PDF copy saved in your email or on your smartphone. And the reason why I say bring a paper copy is because there are some countries out there that actually need to see a physical hard copy of it. So it's always good to have two. Personal health. You do not want to be running yourself ragged before you travel, even in non-COVID days. So now if you throw all this on top of it, you want to make sure that you're prepared to travel. Make sure you're getting enough rest. Make sure you're sleeping good. Make sure you're eating good. Make sure you're drinking enough water. And make sure that, you're not out there, binge drinking every night for the week before you travel. Because listen, our immune system is a responsive system. If we are running ourselves ragged, and if we are not taking good care of ourselves from our nutrition and our sleep and our renewing processes, our immune system is going to be really, really run down. And guess what? That opens you up to get viruses even above and beyond COVID, the cold virus, the flu, etc. So always make sure that you're taking care of yourself first. Also, you want to make sure that you stock up on safety items. And these are my personal recommendations of what you should bring on a trip. And this can even go, beyond the rest of your travel days. Hand sanitizer. And you want to make sure you bring a lot of hand sanitizer. Like if you're going on a trip for 10 days, you might need more than one bottle. And also make sure that those bottles are small enough that they can fit on your carry-on if you're not going to check baggage. Also, sanitizing wipes. It's really good to have sanitizing wipes, especially if you're going to be on a really long flight. So when I go to Bali next May, I know that's going to be a super long flight. And I know that I'm going to have to get up and use the restroom multiple times. I know that I'm probably going to want to wipe down surfaces. So wipes and hand sanitizer. Also, you want to make sure that you bring a thermometer, plenty of masks, Tylenol, travel meds. And when I say travel meds, things that are simple, things like, obviously Tylenol. You also want to make sure that you bring something if you have any seasonal allergies. You also want to bring something if you have traveler's diarrhea. That's just pretty basic stuff. And the reason why I suggest bringing a thermometer is because, listen, at the end of the day, we still need to be vigilant about making sure that we are doing the most prudent things as individuals in order to benefit the health of ourselves and the group. So a thermometer is good because sometimes you might not really know if you're running a fever, and you might think that you don't have a fever, but you actually do. Your thermometer is there just to give you that solid, yes, you do, or no, you don't. And my last suggestion is nose and nasal sanitizer. Nose and nasal sanitizer, and full disclosure, I do partner with them for social media content, but it's a product that I use personally, and I've traveled 4 times in the last few months. And it's also a product that I fully support. Your nose is an avenue for things to get in: bacteria, microorganisms, viruses. So the same way that hand sanitizer works for your hands, nose and nasal sanitizer is basically hand sanitizer for your nose. It doesn't sting, it doesn't hurt, it actually smells like oranges. There's a link in my Instagram bio if you guys are interested in ordering them. My Instagram is @the_Katie_Duke. But it's a really good way to help decrease ways that viruses can be introduced to your body, and it's good for 12 hours. So those are our precautions that we want to take beforehand. If you're not overwhelmed yet, don't worry, there's more coming. Listen, I know this is a lot of information, but when you look at these slides, and if you're taking notes, You don't have to be overwhelmed because, well, actually, it's okay to be overwhelmed. However, remember, you're not traveling alone. You're going to have all of the resources of TrovaTrip staff, TrovaTrip hosts, and everybody here to help you out and answer questions. So let's talk about what you're going to do during the trip, during your travel. You always want to try to make sure you can plan as much weather permitting outdoor activities and dining. It's also good to give a heads up to inquire at hotels and restaurants if they're maintaining any social distancing guidelines and safety precautions, and also if they have a mask mandate. It's really good if hotels and restaurants are doing that because it shows that they respect public health guidelines and that they care about people's health and wellness. Also, you want to make sure that you monitor for any symptoms. And again, that's another reason why I said that you should bring a thermometer, because there's a lot of reasons that people can get sick while they're traveling, but not a lot of things will always cause fever. And we know that one of the things that COVID can present with is fever. So, if you wake up one day and something isn't right, it's good to monitor these things. Make sure that the group you're traveling with has a system for notifying everybody if there have been any exposures or positive tests. And again, this is something that TrovaTrip will be helping out with at an individual level and that they are fully vetted in. Also, restaurants and hotels that you go to should also have a process in place for notifying people of positive test tracing. For example, in New York, whenever you make a reservation at a restaurant or a hotel, you have to fill out your name, your email, your cell phone number. And anytime somebody has a positive test in New York, the New York City Department of Health gets notified, and then they trace that person's activities, and then they notify people who maybe were at the same restaurant on Thursday night with them. So it's actually a really good and a really proactive way to help to bring the curve down, because we know, and the data shows, that positive test tracing processes help to decrease COVID spread. So those are the precautions that you're going to take before and then during. So now let's talk about, what do you do when you get home afterward? Look at this. We barely have a list here for you. Why? Because you have done a majority of the work so far. So congratulations, you have made it to the end of your trip. You're probably feeling refreshed, renewed. This is actually a picture of me in Bali last year. And I just cannot wait to go back. And I'm super excited because the Bali trip is going to be a wheelchair accessible, fully accessible, vetted trip. And I'm super excited. So the two things that you want to do when you come back. Now, these are the two most important things that you can do. You have already been doing all this great work. So make sure you get a test upon your return to your home state and see if your home state has any public health or any professional guidelines for how long you should quarantine if it's required by law. There are some states that say you have to do this quarantine or you have to do that quarantine, but right now a majority of the states are telling you that you can quarantine for 7 days unless you have a negative test. Because we do know that quarantine laws have recently changed, because the data shows that you don't need to quarantine for 14 days if you have a negative test. So do your homework. Whatever state you live in or wherever you're returning to, find out what their policy is and make an arrangement to get that test done. And the last thing is, continue your safety precautions and wearing a mask. There is data out there. When you wear a mask, you decrease your rate of transmission by 88%. That is such a big number. So find a cute mask, get comfortable with it. It's going to be there for a little while, but not forever, and prepare for travel the smart way.
Thank you so much, Katie. Those are such helpful tips. I can't believe you had such a severe case. Thank you so much that you're doing better. And I'm now going to have Carolyn and Tu Anh and Katie jump back on their cameras, and we're going to do some Q&A. So when you guys all registered for this event, you submitted questions. So we compiled some of the most frequently asked ones, and we're going to jump into them. So first question is for Katie. Are filtering masks, such as a KN95 or N95, needed to protect yourself from those who aren't masking effectively?
Okay, this is actually a really great question, because I know when COVID first came out, this was a big deal, right? People were like, oh my gosh, I need a full-on hazmat suit. But luckily, the reason that healthcare providers wear N95s is because there are two things you have to be worried about when it comes to COVID: your exposure in amount of viral load and the time that you're exposed. So the average person out there who is not working in the face of COVID positive symptomatic patients for 12 hours at a time, basically all your healthcare providers, the average person out there is not going to need an N95 filtering mask whatsoever. The N95 mask is specifically for healthcare providers who are working with known positive symptomatic COVID patients. So that right there is a high exposure in terms of viral load for long periods of time, AKA our 12-hour shifts, which is a long exposure period. So the reason that we have to have those masks is because we're literally in the face of actual COVID for 12 hours at a time. You, as the average person walking around outside, even if you may pass somebody in the street who might have COVID, you still do not need an N95 mask. What you do want to have is this: a mask with 3 layers. Now, most cloth masks right now that you can buy at the drugstore, you can get on Amazon, most of them have 3 layers. So that would be my suggestion to you, but you can 100% continue wearing cloth masks, or you can buy, you know, the blue masks from Amazon. It looks like the hospital masks, but they're not allowed to say that they're hospital grade. The material on those masks is actually what's called unwoven fabric. So it actually filters better than an actual cloth mask.
That is really good to know. This next question jumps back to kind of your, preparation during travel tips. Are travelers allowed to bring Lysol or other disinfecting products on flights?
So yes, so I have traveled 4 times, all on flights, all with Delta. And again, this is just my personal experience, but the only thing that you have to worry about bringing things on board is does it meet the liquid measurement amount that the FAA requires. So, anytime you bring something on the flight, it has to be 3.5 ounces or less. So, sorry. I have, I'm sorry. I have like word finding difficulties every now and then. Thanks COVID. This is COVID's gift to me. Whenever I try to concentrate on something, I'm like, here it goes. So if you're going to fly, and you want to bring your own disinfecting products, you can bring whatever you want. You can bring Lysol wipes, you can bring Lysol foam, you can bring Lysol liquid, but it has to be under 3.5 ounces in order for you to bring it on the flight. I literally saw the woman who was like 2 rows ahead of me. She literally brought like a Costco size bottle of Clorox bleach wipes. And it was just like a regular thing. People are like, oh, that's good preparation, even though, they religiously cleaned like the entire airplane. But it's funny because she was like handing them out to people.
That's a good person to have next to you on the flight, passing out the
right?
cleaning
Very,
material.
very prepared.
So a question we had from one of our audience members: if they've already had COVID, do they still need to wear a mask?
Yes, they do. So I had COVID. In fact, I am 6 months out from COVID, and I even still have my antibodies, which is great. However, the reason why you still need to wear your mask is for this right here. There's 2 facets to this. For one, there is no data that shows that you will not get reinfected. Okay. There is just no data for that right now. Number 2, you can be reinfected and have no symptoms whatsoever and feel completely normal. And that might not be a problem for you, but for the elderly person who might be on a lot of medication next to you on the plane, that would be an issue if you weren't wearing a mask, because you know what? They would get sick. And that person could have really severe complications. So wearing the mask, it might not always be something beneficial to you, but it will always be beneficial to other people. And that's just part of being a good human. So yes, you got to wear your mask.
Definitely. And in line with that same question, if they already had COVID, can they get it again while traveling?
So they can. So again, we do not have any data right now that states that we cannot get reinfected. So just to be a very prudent provider, I would advise you, yes, anytime you leave your house, you're at risk of getting COVID, 100%. However, which is what we're talking about tonight, is how do we approach these things the smart way? So if you don't go out there and you're just like not some like careless, reckless maverick, you know, you're washing your hands, you're wearing your hand sanitizer, everybody's being prudent and precautious, you know, your chance of getting it while traveling is going to be drastically declined. And again, you're talking to somebody who has traveled internationally and domestically 4 times in the last few months. And so I 100% back up what I am saying.
That's great to hear. One of the audience members just found out they're pregnant. Woohoo. Is it safe for them to travel?
Well, congratulations. Oh, well, this is exciting. So, you know, what's really exciting is that there are some studies that are coming out showing that babies are being born with antibodies, which is fascinating because it's like, what a better gift than to give your newborn than some COVID antibodies, than some coronavirus antibodies. So congratulations. That is so exciting. Lord knows we need some good news like this. So whoever that is out there, congratulations. The question is, you know, is it safe to travel? I would tell you that you definitely need to talk to your OBGYN and clear that with them. I cannot give you advice on that because that's not my department, and you got to check that out with your doctor.
So maybe more in your department, do you have any safety tips for all the travel nurses out there?
So I think for the travel nurses, I would just tell everybody that you need to check with your hospital, or who, if you're employed with a specific hospital, or if it's like a specific agency that you're employed with, you have to check with them to make sure that they will not make you do any sort of like mandatory quarantine that might interrupt with your work schedule after you back from travel. So honestly, listen, us nurses, we need to get out of town. We need a break. We need to get out of here. So I fully support it. But again, just double check with your employer and make sure that they don't have any like extra, you know, restrictions that would make you need to be a little more mindful of your time schedule when you get back.
Definitely. Next couple of questions kind of for TrovaTrip, so I'll take those. First up, with talks of new shutdowns, what are the next steps? So we're monitoring the situation very closely, and we stay in very close contact with our operators to stay up to date on closures and restrictions well in advance of all trips. So next steps honestly depends on when and where your trip is. And when traveling with TrovaTrip, you know, like Katie has mentioned, we take a lot of that guesswork out of it. We provide you that information on a trip-by-trip basis, but it really does vary based on kind of where it is you're talking about. The next question, if someone has opted out of taking the COVID vaccine, are they banned from traveling? So we will work very closely with our local partners and health officials to follow all of the necessary policies related to vaccinations and to make sure that we keep our travelers like totally informed on that. Should there be any specific requirements related to your trip, we will notify you immediately. However, at this point, we honestly just don't know enough to answer that question fully. Next, is COVID testing required for travel with TrovaTrip regardless of destination regulations? So TrovaTrip and our operating partners follow all the guidelines and regulations set forth by the local government, regulatory bodies of our destinations offered. And some destinations may require tests pre-departure, and we'll inform you of this if the trip that you're going on is one of those destinations. We do recommend that you also check in with your local health officials, the State Department or Foreign Office, and your airline to see if they have any additional requirements for your departure or for your return, because that's obviously really important. Our next question is for Tu Anh. What happens if someone becomes sick on a trip in Bali?
Well, thanks, Hope. So if anyone show any symptom during the trip, then they will be escorted to a medical care for testing immediately. And all of our vehicle, everything that person get in touch with will be clear and disinfected. And because we operate in multiple destinations, so we will follow the guideline instructed by the destination where the trip is operating in. And if there is a positive result, then we will rearrange the booking for the travelers and any people exposed to that COVID case. And on the canceling plan, finding the best hotel for quarantining will be taken care by us.
Thank you. That's really helpful information. We actually had a similar question for TrovaTrip. So what happens if someone becomes sick on any TrovaTrip? So like I said, we are regularly conversing with all of our local partners to ensure that it's safe to operate in that destination to begin with, and that preventative measures have been adopted. Some of these measures include, lower capacity vehicles, easy access to hand sanitizers, masks, social distancing. But in the event that a guest does contract COVID-19 while on one of our trips, we do have an internal crisis management system that lays out clear rules and protocols, and it allows us to coordinate with our local partners. And so we can guarantee swift action to protect the health and safety of our guests. And then like Tu Anh mentioned, we have, in-country protocols as well. So another question for you, Tu Anh, what are the current travel restrictions for US citizens going to Bali? And do you think travel will be possible by May of 2021?
Well, right now, no one can enter Indonesia from the USA if they don't have a current valid visa. And a negative test is a must to enter the country. And all traveler will need to do a quarantine upon arrival. I would say no, there's so much uncertainty right now. So I assume no one can say when travel will return for certain yet. But with the news of vaccine, we are all very optimistic that travel will be back by summer 2021. But this year has been a lot around people being patient with the situation.
Yes, we have definitely all learned a lot about patience this year. So we had a similar question for Morocco. So how is Morocco looking, and are we safe to go there? Right now, Morocco is currently open to foreign travelers, and our operator is taking every precaution that they can take to increase traveler safety on the ground. So as of right now, Katie's trip in May is still a go. And currently, all of our trips are reviewed 120 days prior to departure to determine if it will operate, and a decision is made at least 90 days before the trip, which is before travelers need to pay their final balance. So if a trip is rescheduled, travelers will be notified as soon as possible. If the trip was rescheduled due to COVID and the new dates don't work for the traveler, we can provide a credit for the total amount to be paid to be used on a future departure through 2022, and a refund of the balance, or a refund of the balance payment and a credit for the down payment to be used on a future departure through 2022. Now, terms and conditions, I know, can be really confusing. So if you didn't catch all that, you can find it on our website, or you can reach out with specific trip questions at hi@trovatrip.com. So speaking of trips, Katie, one of our audience members wanted to know what made you want to host a wheelchair accessible trip?
Honestly, why is it even an issue? There shouldn't have been a kind of situation where it's like, oh my gosh, we need to do this. It should have been in existence. But luckily, again, this is one of the reasons why I partner with TrovaTrip, is because you guys are very innovative, and, you guys are willing to put in the extra work that it takes to put together a trip that is properly vetted. And honestly, I have friends who use wheelchairs, and an accessible trip is necessary so that we can all hang out together. I've hosted other trips where my friends were not able to come, and that really it really kind of hurt me, because I was like, that's not fair. Why is that even an issue? So, this is something that should be open and accessible to everybody.
100%. And what's really awesome is that Tu Anh is actually our lead trip designer for our Bali trip. So she actually designed Katie's accessible trip. So really full circle here. The next question is for Tu Anh. What considerations were taken when designing the wheelchair accessible trips?
Well, the team here was super excited when TrovaTrip asked us to work together to design a wheelchair accessible trip in Bali. So, Bali is an island with a lot of different scenery, and people know Bali for the beautiful mountain scenery and beautiful rice field, apart from on the cliff and beaches So the question is, where should we take travelers to on a well-traveled friendly trip? So a lot of consideration were taken into when we design this trip. We handpicked the destination where it's more accessible, friendly. We take people more to the beach area of Bali, like Sanur, Ligan, Simiak area instead of the mountainous area. And also we source out the vehicle with hydraulic lift to support well-traveled transportation. We also select those accommodation with well-traveled friendly features. So the participant can feel comfortable staying in the hotel. And we have a handful of very well-educated, compassionate guy, and we will conduct accessibility training before the trip happens. So super excited and look forward for this trip to happen.
Thank you, Tu Anh. It's so fun hearing about all the considerations that you took and then having it be full circle and having them happening with Katie. So our final question of the night is a fun one that we got quite a bit. Will we be adding more spots and vacations for 2021? And the answer is yes. We are constantly designing new trips and looking at expansion globally. We're currently launching trips into next fall, winter, and into 2022 already. So as far as new destinations go, we have some really cool trips coming. We're expanding in Asia, Europe, Latin America, Africa, and domestically. And we're looking to delve further into foodie and ski itineraries. So a ski trip to Japan 2022, maybe. So as we look forward towards the future in 2021 and 2022, it's clear it's really important to stay educated. So thank you all so much for tuning in and learning with us tonight. A huge thank you to Carolyn and Tu Anh from Discova and Katie for joining us today and sharing your experiences. As a travel company, we have a responsibility to make sure that we promote travel that does the most good for the most people and to navigate travel in the most responsible manner. We're always striving to improve and share our resources. So thank you again for tuning in, and we hope to see you all on a trip in the future. Thank you.